staff shortages for nurses. I think this is going to be a really intense next few years. Let's have a conversation. Welcome to the channel, everyone. My name's Fola, and here on Deep Mind Squared, we talk all things bridging mental wellness and spirituality for nurses. In this video, I wanted to talk a bit about this staff shortage that seems very apparent, I think, across the world right now, especially in North America. We're hearing a lot of different things coming out in the news around how there's not enough nurses and other healthcare professionals working, and what this is doing to our entire healthcare system and obviously patient care. This is kind of scary if you think about it, considering we're in this world pandemic situation with COVID. And a lot of people, especially nurses, are struggling to keep up with the work. So before we get into all that, make sure you hit that subscribe button and the notification bell so that you're updated on future video releases. And I'm going to share with you some ways that have kind of helped me when I was working within the healthcare system in a program where there was really quite a bit of staff shortage, and what are some ways you can take care of yourself? So first off, I definitely don't think that COVID is the cause of staff shortage issues. This was happening way before, okay? People are burnt out, especially nurses. We don't have enough care in the workplace for ourselves. There's just this go, go, go mentality, and now, of course, it's going to hit everyone in the butt. What do you expect? When we aren't looking after ourselves, we eventually burn out. We get stressed out. And then that's when people start doing things like calling in sick and so forth. I know for myself, I've been there where it was I just could not handle some days where I'm I cannot be there. I have to just stay home. And to me, that is taking care of the self. So wherever you might be and whatever your sick time benefits and sick time payout, whatever you want to call it, looks like for you, make sure that you look after yourself and have a conversation maybe with leadership or your union around how you can best balance your life, because you taking care of you is priority number one. I think I've said that in every video, but just that reminder again. What's one of the first things that you can start to do if you're noticing that there's such a staff shortage on your unit or wherever it might be that you're placed? I think the first thing is really to manage your own workload. Really getting clear on what is a priority for you to do and what is something that just can maybe be delegated elsewhere or put off to some other time. Obviously, depending where you're working, this might be an easier task than others. Sometimes people are being micromanaged and it seems like you don't have a choice. We'll talk about another technique for that one in a little bit. But if this is case for you where, there's just 1,000 things to do, it might be really important. And I think this is where nurses excel, is going through tasks and prioritizing the tasks of what actually needs to happen. Making lists has really helped me when I'm working, because otherwise I do get completely bombarded. And let's remember, this is a trauma response in our entire collective of humanity. So sometimes our mind, our brain might not be operating optimally, and it's okay to need to do things differently at this point. And once you've created that list, obviously make your way through it. But give yourself this flexibility to change what might have seemed like a priority before and no longer is. And I understand maybe in some higher paced work environments like ICU and the ER, this might be a bit of a challenge, but definitely fall onto your teammates then. And this, I think, is something that we're seeing a lot. It can be hard when there's maybe not the right staff complement on the unit, or people that you're working with are folks who've been deployed there, you have no relationship with them. So maybe it's time to try and build those relationships. Seeing people from this compassionate lens and understanding that they too are struggling, instead of this bullying mentality that seems to come onto units with more senior staff being there first, where it's oh, you're an outsider, you're not welcome. It's that's not doing good for anyone. That makes everything way worse. So get your fucking head out of your ass and be nice to people and see that people are trying to do the same thing that you're trying to do. And we're all doing the best that we can, in a fucking pandemic. I don't really know why I have to say anything else about that. Next would be maybe the more challenging one, and that's to just set boundaries and say no. Of course, if you're being micromanaged by certain leadership styles, I understand that this saying no can be a bit of a challenge. Some people in certain countries might even risk losing their jobs. Very grateful here in Canada, we have a union, and usually you're allowed a little bit of wiggle room for that. But I personally have learned since leaving, especially like the healthcare system, that we don't have to say yes to everything. Obviously, you know, if you're like one of like two nurses on and the other one's on their break and then someone's coming on like to be admitted to the unit or whatever, you might have to do it even though you don't want to. But I think there's wiggle room here where we can use our beautiful ability to communicate with one another, again, in a way that can be coming from the heart and from feeling, not from the like, you are doing this and I don't like it. More, you know what, I'm feeling really overwhelmed right now. I feel as though this might need to be given to someone else as a task to do. And compromising, what's something else that we can trade off so that this seems more in balance with each other. Ultimately, though, I truly believe, like, ask and you shall receive, or as my aunt would say, people will just say no. So whatever, you tried, and then try to renegotiate something else. And then finally, thinking outside the box. This one is going to be a little bit of a push because the healthcare system in itself is this box, this like systemic program that has operated for so long. And the code, the program of it has been written, and there's not a whole lot of room to like hack in and put your own code in there. This is how my mind works. But it's like, it is possible, and we need to start really thinking outside of the box. So how can you start to look outside of the box and connect to new ideas? And this might be as simple as sitting with your coworkers in a meeting, because I think that's also very important. Encourage your like leadership to be having regular contact between all the staff, even though I understand that can be hard with different shift changes and all that. But it is important that this continual communication happens so that everyone feels like they're on the same page and everyone's ideas can be shared, because there are no stupid ideas, especially in a pandemic. We are in a place of in time where we are really being pushed to our limits. So why not create something new? So I'll leave these with you today. Obviously, feel free to share in the comments if there's any way that you found helpful to support yourself during this staff shortage time that seems to be continuing for decades and decades, and probably will continue until the system crumbles. Sorry, it's my positive outlook. And obviously feel free to like and share this video with anyone you think might need to hear this message today. And I look forward to seeing you all in another video. Take care.